This is the deltoid, okay? So here would be like your chromium process. That's just like right where the arm starts to fall down. You're going to go down to our two finger whips there. You want to clean it in a circular motion. Now, if you can't remember, if you wipe it and then you got to open up your needle or whatever, and you can't remember, just leave it sitting right there for just a second while you get your stuff ready. So I'm going to say I got my med ready. So to give our Z-Track injection, what you do is you take your fingers and you're going to pull the skin like 1 inch over. You're pulling this taut. Okay, Miss Jones, I'm going to give you an injection. So go in. I grab it with these fingers. I'm still keeping this pulled tight. Okay? I'm going to aspirate back for 5 to 10 seconds. I don't see any blood in there. I'm still keeping this pulled tight. Now I'm going to push in my medication slowly. Then I'll pull the needle out and I let go with my hand at the same time, because when I pull this back, what I've been holding tight now goes back over and makes like a sealed lock over it. Okay? That's what Z-Track means. Alright, so then afterwards, if you have a cotton ball, you just put it right there in case it bleeds for a second. Don't massage it or anything like that. Alright, any questions about the Z-Track part? Alright, so that's the deltoid.
It's going to get hard, but I would have said it. Well, we won't have fun.
Here. Up here we have our greater trochanter. Here we have our lateral condyle, right? Right, we're going to go the middle 1/3. Alright, we're going to go to our middle third right here. Okay. As far as the Z-Track goes, after you do it, you're going to learn the hand motions that work for you. Everybody has to get their own rhythm. This is just the way I do it, and it works for me. Okay, I'm going to pull it over. You know, some people might want to pull it up, some might want to pull it down, as long as you're doing your inch. Okay, so I'm pulling over. Okay, I'm going to go in. I'm still holding over. I'm grabbing it with that. I pull back my 5 to 10 seconds. No blood. I'm going to inject slowly. Pull out. Okay. Alright, we'll give them one side. Basically, putting your hand here on the greater trochanter. Obviously, the thinner the person is, it's easier to find. Okay. We're going to go right here. I really think this little pad thing right here is meant for the gluteus maximus. Again, same concept. Pull it over. Shut it in. Aspirate for 5 to 10. No blood. We inject. Pull out. What do we do if we get blood?
Stop.
Throw the whole thing away and start over. Exactly. I've gotten blood, I think, one time, and it was the very first injection I ever gave when I graduated from nursing school. Scared me to death. Oh my God, where did it come from? All right, what questions do you have? Okay, injection. About 2 inches out from the belly button is where you would do your Lovenox or heparin type injection. If you're given insulin or a blood thinner, you do not aspirate. Other sub-Qs you aspirate just like you did with your IMs. So in other words, we would just, and you don't do the Z-Track. You either decide if you're going 45 degrees or 90 degrees. Based on the patient's size, you just go in, inject the med, pull out. So no aspirating there. No
Lovenox as well. It's just pretty much heparin.
It's
Same thing.
It's called a low molecular weight heparin, and that is the most common of what they use now. Heparin itself is a very dangerous drug because it comes in units, and it gets very confusing. And there's been a lot of med errors with heparin itself. So that, and another thing, the reason they went to Lovenox is you don't have to have lab draws done for it, which heparin you do to make sure their PTT is within normal range. So Lovenox used to be really, really expensive, but now it's not as expensive anymore. And a lot of patients go home with it, especially if they've had hip surgery, knee surgery, something like that. They'll go home.
Granny used to have to get it.
So you'll teach the patients how to do it themselves.
So is it the smaller the person, is it 45 degrees?
Correct. Because if they're small and I go in at 90 degrees, that means it's going to go deeper, and that means more than likely I'm going to go into their muscle rather than the sub-Q instead of the fatty skin.
When we check off,
They don't have much fatty skin.
you want us to do 45 on her? When we check off?
We'll probably give you we might give you a scenario. Say if this person's 200 pounds, would you give a 45 or 90 or something like that?
Tell me 45. Like that.
All right, guys. Any questions on that?